Hey guys, welcome to Health with Samantha DPT. This is video number 2 in a series of low back pain videos. And today's cause that we'll talk about is sciatica, clear up what that term means, and Piriformis Syndrome. So these are the causes of low back pain we'll be talking about today, okay? So I feel like sciatica is a pretty commonly used term, but maybe misunderstood. So literally sciatica means inflammation of the sciatic nerve. The sciatic nerve is the largest nerve we have in our body. It starts in the back of your hip and runs down the course of your leg, the posterior side of your leg, and has different branches to innervate and cause sensory and motor control of your leg. Okay, so I have a picture of where it is in the body here. So this big yellow cord that runs down the back of the thigh here. So here's the glute, the back of the hamstrings. That's the sciatic nerve. And it's hard to tell, but this piriformis muscle is right above it, and the sciatic nerve comes out right below it. Okay? So as you might imagine, if something's going on with the piriformis muscle and it starts to impinge on the sciatic nerve, that is probably the truest form of sciatica, actually causing disruption and inflammation of the sciatic nerve. Now, there's other forms of pain that happens down the back of the leg. This is usually referred to as radicular pain, and that is more caused from one of the discs in your spine in between the two vertebrae. It gets loose, dislodged, and starts impinging on the nerve roots that come out from your lumbar spine. This also could be caused from stenosis, which is another topic that I'll be talking about for low back pain, but that is narrowing of the spine, and that starts to impinge on the nerve roots. So these different nerve roots have different levels, and they can be affected, like I said, by narrowing or stenosis or the discs, and start causing pain along that specific nerve root pathway. So that might be why you're experiencing some pain throughout your leg, not truly the sciatic nerve getting impinged. That being said, the sciatic nerve is made up of L4 through S3 different nerve roots, so depending on where you have blockage, you might feel different sensations. But the sciatic nerve actually comes out of the glutes, and it's made up of different nerve roots. It's not exiting your spine. Just so I wanted to clarify that. So there's different causes for why you may have pain, tingling, numbness in your leg. But sciatica, if you actually have inflammation of your sciatic nerve, which you can, it's a little bit different. So, like I said, the piriformis can definitely influence the sciatic nerve due to its anatomical position being so close. So you may have really tight glutes, whether that's from sitting a lot and you're actually putting pressure on the muscle and the nerve itself, and that's causing irritation. So that would require probably some manual therapy to that area, a massage if you wanted, some stretches. Definitely going to a physical therapist and getting a thorough examination and advice on what kind of stretching exercises to do would be very helpful. There is an activity called sciatic nerve glides, which is basically trying to floss the nerve back and forth like a stretch for a muscle, but this is specific to a nerve. So if there is any blockage along the pathway, you're kind of clearing it up. Now, you can overstretch the nerve and cause more irritation. So we typically say 3 sets of 10 when it comes to sciatic nerve glides. And maybe in a future video I'll show how to do that, but that is one of the things that you can do to help the sciatic nerve. Otherwise, being aware of your posture, like I said, seeing a clinician to get some specific exercises and stretches, you'll probably find that you're sore in that area, may need loosened up. But the biggest thing is if you're having numbness and tingling in the leg, you definitely want to get examined to figure out the true cause of why you're having this, whether it's from your actual lumbar spine, the sciatic nerve, different radicular things that could be going on. You definitely want to get that checked out. All right, so if you have any questions, please feel free to message and comment and subscribe to hear more about other causes for low back pain. Thank you.